So welcome everyone to the World Hepatitis Summit session, Youth Can't Wait. I'd like to briefly introduce myself. My name is Matthew Bond. I'm the program manager with the Canadian Association of People Who Use Drugs. I'm an international board member with the International Network for Health and Hepatitis and Substance Users and a knowledge translator for the Dr. Peter Center, and I use the pronouns he, him. Before passing it off to my co-chair, I'd like to do a quick land acknowledgement and understand this is an international context. A little bit about a land acknowledgement is that acknowledging territory shows recognition and of respect for Indigenous people. It is a recognition of their presence both in the past and in the present. Recognition and respect are essential elements of establishing healthy and reciprocal relations. So I'd like to begin by acknowledging that where I'm joining from is the land of the Mi'kmaq, also known as Nova Scotia, Canada, and is the ancestral and unceded territory of the Mi'kmaq people. So I'm going to pass it over to my co-chair, Dr. Tasnia, to introduce herself and provide some detail on how today's session will flow.
And hi everyone, I'm Tasnia. So I'm representing the Bangladesh Medical Student Society, which is a voluntary non-profitable organization of medical students in Bangladesh. So as a medical student, I've been advocating for public health issues for the last 6 years, and recently just graduated. To talk about this session is about possibilities. We want to find ways of empowering young people living with hepatitis to live full and healthy lives and to become advocates for change themselves. And we want to celebrate the energy and activism of youth and bring that energy into the viral hepatitis elimination movement. We have 7 amazing presenters with us today who will help us visualize how these possibilities can be turned into realities. And I will be introducing them as we go. For now, Matthew, would you like to share with us your own personal story in order for us to start?
Yeah, for sure. So I was asked to share briefly about my own personal story with hepatitis C before today's session. So I am somebody who uses drugs and somebody who has been tested and treated for hepatitis C. I don't consider myself a youth anymore, but when I did go through this experience, I definitely was. So I was diagnosed with hepatitis C about approximately 10 years ago through my opioid agonist therapy clinic. At the time, I was only 22 and I didn't know anything about hepatitis C, but I thought it was odd that, I was diagnosed and I wasn't treated. So I kind of did some, my own digging and research on education and awareness around hepatitis C and how different, ways or how it's transmitted or contracted. And, I was really vigilant on, not transmitting it to other people in my community. And through that, I experienced different levels of stigma and discrimination, either through my employment setting. I remember one time I was cut and, I let my employer know, and then he kind of told everybody, and, I just wasn't treated the same afterwards. And, really, I was just trying to protect other people so they didn't contract hepatitis C. But also I experienced it even in the drug using community when, if I was sharing a straw or sharing needles with somebody, like I wouldn't share them and I would tell them why. And they're like, oh, I don't want to hear that. So, I've been very vocal about my story and everything since. I have received treatment since then in 2019. At the time I wasn't using and I was in a sober living facility. So the context was different and the treatment options were different. And ever since then, I got involved in kind of the local harm reduction community with a heavy emphasis and involvement around hepatitis C to try to, just empower people to go get tested and treated. So that's a little bit about my story, and I'll pass it back to Tasnia to introduce our first speaker.
Thank you, Matthew. Next, we have David Hewitt, and he's a hepatitis patient himself and an advocate, and he'll be sharing his personal story of living with hepatitis with us. David?
Thank you, Tasnia. It's my great honor to be here speaking today. Like Matthew, I don't exactly consider myself a youth anymore, but I've lived with hepatitis B my entire life, and it's my privilege to be able to speak about some of the challenges I faced living with it as a younger person. So my first memory of hepatitis B, it came when my parents, who adopted me from South Korea when I was 5 months old, they sat me down and they said, son, you've got a chronic illness that is affecting your liver, we have decided to tell you today, and we want to take you to a liver specialist to give you some information on something that, you know, we are very concerned about, but didn't feel it was right to tell you about until now. I learned that day about the basics of managing hepatitis B, the transmissibility aspect of it, which completely terrified me as a 13-year-old. I remember also hearing, you know, the positives about how patients can control and manage this disease with, you know, proper diet, staying away from alcohol, and proper checkups with the liver doctor semi-annually. But to be honest, that wasn't what I was thinking about while I was receiving all this information. The only thoughts that were really going through my head at that time were, how am I going to recover from this? And if I would have any chance at the life I thought I was going to be able to have back then. I remember going back to school after that appointment and having my life kind of completely start to unravel quite quickly after that. I was heavily involved in sports and music, had a robust friend group, but I decided to withdraw from all of that and kind of just internalize all the questions I wasn't quite able to ask at that appointment. And also I took some of the dangers and the scary things about hepatitis B as guarantees. And that just put me in a mindset of being in a place where recovery wasn't possible and that help just wasn't something I could reach out for. By the time I was 14 and in high school, my days were filled with suicidal thoughts, and essentially every day was just a survival of getting through school, getting back to home to where I could just repeat the same thing over again. And eventually that took its toll. And one night before a band concert in my freshman year, I decided to take as many acetaminophen pills as I could find that were in my parents' cabinet. And being the internalist that I am, I decided to not tell them about that until the next morning. So pretty quickly, I found myself being rushed to an emergency room, being asked a lot of questions that I'd never been asked before by doctors I'd never met. I was referred to a psychiatrist shortly after that who talked to me about depression and medication and options for me at that time. But at no point of this did I hear anything about hepatitis B and how this might have been a factor in what led me to that suicide attempt. I experienced years of clinical depression, social anxiety, social isolation. I tried self-medicating throughout my teens with cannabis and alcohol to no avail. I just didn't have the courage to talk about this with any of my friends or peer group because, to be honest, I didn't think I would be accepted, and I thought it would have been a social suicide for me, when I was already struggling with so many other issues. So I decided to just have making it through school be my main sort of light to look at as far as a reason to stay alive. Again, talking with hepatitis B with other groups felt like there were a few barriers in place. My therapist that my parents got me to see just was not equipped to talk about a chronic illness. She didn't really understand the aspects of Hep B and the fears I had that were causing me so much pain. I didn't actually talk about Hep B with anyone from that visit to the clinic when I was 13 until I was 18 years old, except for one instance where I informed the potential romantic partner of my status and the precautions that she could take to protect herself. And unfortunately, I was rejected outright and was told that it was only because of what I just told her, and that this was too scary for her to handle, and that to not talk to her again. So that was what I internalized, and that's when the self stigmatization that I imparted on myself really started to take effect. I don't remember feeling more alone at that moment, and I couldn't talk about it with anyone, so I held everything inside, which just made everything more painful. After I was out of school, my relationships with my liver doctors became completely unmanageable. I would skip years and years of liver function tests. Anytime my parents tried to convince me to go back to the doctor, they were met with many, many no's, and I just didn't have any hope that going back to the doctor and starting to treat this as a real thing in my life would help at all. So again, I continued to self-medicate and isolate. And eventually, when I turned 20, I started to self-medicate with more drugs, including amphetamines, opiates, and cannabis and alcohol as before. This was an attempt to dull all the psychological pain I was feeling, and I was so disconnected in my life and completely hopeless that this felt like the only option I had at the time. I had to learn how to start an honest relationship with myself about hepatitis B and with my doctors. This wasn't something that worked for me until my late 20s, so it's been a battle. I had just recovered from a depressive episode around that time and was starting to make social connections again. I don't know exactly what clicked in me, but I decided to make a promise to myself to speak honestly to my doctors about what was going on in my life as far as drugs and alcohol in order for them to make the best health decisions on my behalf. I could tell my parents and my friends were a bit concerned after I started to open up a little bit to them about my concerns with Hep B. But their advice was go to your doctor and start taking a bit more control of this. This was great timing because around early 2019, after a liver function test came back with high levels of ALT and AST, my liver doctor's team actually recommended me to get a liver biopsy, which was completely terrifying to me at the time. But once the liver biopsy was over, I was happy that I did it and happy that I listened to their advice. Luckily, my liver had no scarring and I'm in great shape right now. Medication was recommended and I started to take it, and my viral load is undetectable as to this day, and my thanks goes to the medication for that. I've always been very, very worried about possibly passing this on to someone. This has been a huge worry of mine since that visit at the clinic, and it's really informed a lot of the decisions I've made and sort of informed how I've lived my life and socialized with other people. And hearing that viral load was down so low that I essentially was non-reactive was just some of the best news I've heard in the last 5 years. A month after the biopsy, I was browsing Facebook and just saw a suggestive video from the Hepatitis B Foundation based in the United States. It was a hashtag Just B Story, which is a patient storytelling program run by Ray Aracho of the Hep B Foundation. The story was told by a woman who suddenly found out she had Hep B, similar to me. She talked about all of the fears, challenges, and confusion she had, along with all the acceptances and successes she had after that realization. Watching that video moved me in ways that are hard to put into words. I felt like my struggles with hepatitis B were really heard for the first time, and as a patient, I actually felt validated. It was a very serendipitous time in my life. A month or so after watching that video, I received a direct message from a staff member at the Hepatitis B Foundation. Before I knew it, I was on a flight to California to create my own hashtag Just B Story to share with the world. I met 10 or so other Hep B patients that were making their own videos to share. Meeting and speaking with these amazing and inspiring people made me feel like a part of a tight-knit community for the first time in my life. I'd never felt that before, and it inspired me to be like them and continue to speak out and advocate for myself and other patients who cannot at this time in their lives. Ever since I made that video, I felt a strong pull to be involved with Hep B advocacy work. Before this, I didn't know what the word advocacy really meant, but now I do, and I want to give other patients what watching that video gave to me: a chance at a happy life and a chance to believe in myself again. I've talked about what it's like living with hepatitis B quite a few times at this point with many different audiences. And I think these types of conversations are where stigmatization is best combated in a non-medical setting. These conversations have included my family at the dinner table, friends, romantic partners, acquaintances, healthcare providers, politicians, and in front of an audience, whether virtual or in person. But I try to tell myself that if I think I'm doing enough, I need to speak out more. There are so many people that aren't able to tell stories like mine because of their geographical location or other reasons. And I think that's one of the saddest things. Our personal stories are the most powerful tools we have as patients. They really are. They pair empathy with data, which is sometimes lost in all the scramble. It attaches faces to our movement, which people need to see to understand that this really impacts actual people that have lives and have dreams. It helps patients connect with themselves and others, and it helps to reduce stigma in the medical community and outside of it. We as younger people can and we will make huge waves with our collective voice. And I'm so honored and happy to be a part of that. Thank you.
Okay, apologies for that. Dr. Charles Ampong-Adjei is an experienced mixed method researcher with a background in research, public health, and his research specializes in infectious diseases. And through Dr. Adjei's presentation, we will learn about the supportive care needs of adolescents who are living with chronic hepatitis B in Ghana.
Oh, my name is Charles Ampong-Adjei from Hepatitis Alliance of Ghana. This study looked at the perceived supportive care needs of adolescents with chronic hepatitis B in Ghana. Hepatitis B viral infection is endemic in Ghana with a prevalence estimate of 8.4% among the adult population. The distribution of hepatitis B in Ghana is uneven in terms of age. Adolescents are disproportionately affected with a prevalence estimate of 14.3%, according to a recent review conducted. People with viral hepatitis, including adolescents, face a number of challenges in their localities, including Ghana. However, studies on adolescents with hepatitis B perceived needs are lacking. Considering the unique characteristics of adolescents, we sought to explore their supportive care needs to assist with program planning and policy formulation. Participants were recruited from a liver clinic in the southern part of the country. Specifically, we use a tertiary health facility. We also use exploratory qualitative design to understand more broadly their needs and the kind of meanings they attach to those needs. Overall, we recruited 18 adolescents with hepatitis B. Although we have an exclusion criteria of 10 to 19 years, a number of the participants who took part in the study were between 18 and 19 years. We processed the data using in vivo and analyzed using Brown and Clade procedure for content analysis. The findings suggest that adolescents have informational needs, and this was more centered on the etiology of hepatitis B and also information as to whether they could be a source of infection to others. For example, there were some adolescents who were pregnant and they were in a state of dilemma whether to terminate their pregnancy to prevent mother-to-child transmission of their infection. They also needed information on their treatment outcome for those who have already initiated treatments. Psychological support was also expressed by the adolescents, and pre-test and post-test counseling were considered to be more appropriate for them because they felt that when they are given that opportunity, they could ask some questions regarding the condition to allay the kind of anxiety that characterizes the diagnosis. They also felt the need to have a social support, precisely hepatitis support group, of individuals who are of their age, so that they could also learn from their experiences and possibly draw inspiration from the coping mechanisms that they use in order to strengthen their resilience. Issue of financial need also came up. And this is because clinical monitoring and treatment is expensive for the average Ghanaian to afford. And these individuals felt that if Ghana government could also add this to the National Health Insurance scheme to take out this cost burden from them, it would also be a very important aspect of their need. So considering these findings, we recommend that there should be a tailor-made liver clinic for adolescents, taking into consideration their unique needs and expectations. Again, we feel that the government must also take a very bold step to include hepatitis B treatment and clinical monitoring costs to the National Health Insurance Scheme to remove that barrier of treatment from this population. And to also benefit from pre-test and post-test counseling, we can also integrate the hepatitis B services or hepatitis services in general into the HIV structures that already exist in the country, so that individuals, before they go for testing, would benefit from this pre-test counseling, and after the testing, they can also benefit from the post-test counseling. Thank you very much. I await your questions. Thank you.
Thank you, Dr. Charles. And we have for your presentation and all your work that you do in the research field. We have you on the line for our Q&A afterwards, and I'll pass it to Tasnia to introduce the next presentation.
Next, we have Anika Martin, who's a quality coordinator at Hawaii Health and Harm Reduction Center, an ambitious public health worker dedicated towards providing the necessary services to marginalized communities to live healthier lives. And through Anika's video, we're going to learn about the innovative use of TikTok to increase community engagement on hepatitis awareness.
Hi everybody, my name is Anika Martin and I will be presenting to you about the innovative use of TikTok to increase community engagement on hepatitis awareness. So research currently does demonstrate that social media holds true potential for health promotion and education because it increases accessibility for health information, interaction, and engagement through different factors such as likes, comments, and shares. And also the customization allows people to tailor different materials towards different themes. Statistics does show that there are 3.78 billion social network users globally, and about 80% of people use social media to search health-related information. HepFree Hawaii has 5 priority areas, one of which is awareness and education. And for the purposes of this project, I wanted to focus our efforts towards increasing our digital presence. Within our digital presence microelimination project, we've established 3 actionable items to increase our digital presence, and one of which was to increase our social media engagement by utilizing online and community influencers. So with the literature and the statistics in mind, I thought branching out to a different social media platform would be of potential. TikTok, originally known was Douyin, launched in China back in 2016, and it was originally used for lip singing and dancing videos. But since then, it's grown into a fully fledged video service with content available for all types of viewers. And since then, TikTok has been downloaded over 3 billion times. It's actually the 7th most downloaded app and the 5th most used app, just behind Facebook, YouTube, WhatsApp, and Instagram. It's actually also reported that TikTok does look to be a true potential competitor against Facebook with the social networking in the West Coast of the United States. So with the immense growth of TikTok, that's what led me to the purpose of this presentation, which was to identify changes in TikTok user engagement by focusing our content on the specific subpopulation in October of 2021, and then comparing those analytics to September of 2021. So Hep Free Hawaii has a work group for each elimination project, and the awareness and education work group meets once a month. In September, although no theme was identified, the work group prepared for the following month by identifying a theme to focus our TikTok content around. We primarily did take a qualitative research approach by asking our work group what sorts of themes did we want our content to follow. And after some discussion, the awareness work group identified that they wanted our TikTok content to focus on the sexual and gender minority population in honor of celebrating Honolulu Pride Month in October. So after that theme was identified, Hep Free Hawaii posted once a week on TikTok for 8 weeks total, 4 in September and 4 in October, while focusing our October's theme on the sexual and gender minority population. At the end of each month, Hep Free Hawaii generated data in their user engagement numbers on their TikTok account. So after posting once a week throughout September and October, we used our Business Suite TikTok account to generate the following user engagement numbers. In September of 2021, we had a total of 128 followers and increased it by 16 in October. And in September, we had a total of 455 video views and then increased our video views to 1,348 in October. And in September, we've also increased the amount of people who viewed our profile by a difference of 18. And lastly, we've also increased our amount of likes, comments, and shares by 95, 5, and 4 respectively. So to date, we are still posting once a week on our TikTok. We've actually posted 62 short videos and have gained a total of 178 followers. As mentioned previously, social media does hold potential to increase engagement and awareness regarding health. And Hep Free Hawaii wanted to branch their social media efforts to encompass TikTok users, considering the growing popularity of the application. And I also wanted to touch base on the COVID-19 pandemic and the influence of it with social media. So the pandemic has directly impacted people and their use of social media, just because research does show that social media use had increased during the pandemic, just because people did want to stay connected to loved ones, but also seek accurate health-related information. And while we were limited in attending or hosting in-person events to increase hepatitis awareness in our community, that's what led us to resorting to using additional social media platforms. And focusing content on specific sub-themes and subpopulations increases engagement just because people are just more likely to share content that engages them virally. And people in general are naturally more in tune to watching content that is more personal to their experiences. The findings of this presentation adds to the small amount of literature on the influence of social media, specifically TikTok and health. I did find that although the TikTok app continues to grow in popularity, the research on its use of promoting health education was very rare. So with that said, I hope this presentation empowers health educators like yourselves to start utilizing more social media platforms to start educating your community about hepatitis. And with that, I wanted to thank you so much for having me. Please feel free to follow our TikTok account along with the rest of our other social media platforms. Our username is @HepFreeHawaii. Thank you so much.
Thank you, Anika, for a very cool presentation on how social media can play a role in hepatitis elimination. And that was at Hep Free Hawaii for all the TikTok users. I'll pass it over to Tasnia.
Okay, next we have Roni Marks, who's been working to raise awareness for hepatitis C for over 20 years. She started her journey as a patient, became a patient advocate herself, and then a facilitator for a HCD support group for 18 years now. In 2010, she founded the organization Hepatitis C Mentor and Support Group. She will share the idea with us of involving children, adolescents, and pregnant people in elimination efforts.
Hello, I'm Ronnie Marks of the Hepatitis C Mentor and Support Group here in the United States, based in New York City. We provide educational and supportive services for anyone affected with hepatitis C or living with both HIV and hepatitis C. If we are going to eliminate hepatitis C, then we have to pay attention to an overlooked population. This population includes children and adolescents, young adults, pregnant people, and people who use drugs. In my travels throughout the country, I started to notice, especially when I was visiting syringe exchange programs, that a lot of people who were testing positive for hepatitis C were with children. So I started to ask them if their children or anyone in their household had been tested, and they all told me they had not. I decided after this to start calling pediatricians around the country, and I learned that no one was paying any attention to these children, especially children that had been exposed because their parent had hepatitis C when they gave birth. I put together a roundtable that consisted of pediatricians, adult hepatologists, community-based organizations, statewide Department of Health representatives, and national hepatitis advocates. We conducted a virtual roundtable where everybody expressed what they were seeing, what they were dealing with, and what needed to be done. At the end of this, I will refer to our poster that is in the gallery, which has the actual table of the results of these roundtables. We all planned that we needed to get campaigns going to raise awareness. We are in the stages of planning print materials that will be disseminated throughout the United States to pediatricians, obstetricians, primary care, and several youth organizations and other organizations around the country. We will be holding webinars with some of our key pediatricians to talk about the issues that need to be addressed. We will be posting on social media, and we will conduct trainings around hepatitis C in these populations. What do we hope to achieve? We hope to educate and spread awareness to providers all over the country and the world. We expect to have direct engagement of youth organizations, either in person or through social media, to educate adolescents on the risks of hepatitis C, especially among people that use drugs and those that are going for tattooing and body piercing. We're hoping to have more advocacy to improve state laws. In some states, if a parent discloses to a pediatrician that they were using around their child, there is a chance of having that child taken away from them. Or in other states, they're even trying to promote child abuse. We have to stop these laws. And most importantly, we need to get a youth movement going to raise awareness of hepatitis C. This could also include hepatitis B. The whole hepatitis community should come together. We plan to make this more available to you down the line, so stay tuned because it's something that I really want to accomplish. Thank you. Please see our poster, which you will find in the poster gallery, to see the chart that I referenced in the earlier slide that shows the results of those roundtables. And for more details on our programs, These are our websites. Please get in touch. We're here to support in any way. Thank you.
Thank you, Ronnie Marks, for a wonderful presentation. I love the idea of a youth hepatitis movement. And I'll pass it over to Taznia to introduce the presentation.
And next we have Dr. Mo Amian, who's the adolescent HIV lead at WHO headquarters, who will shed light on the importance of the youth-centered movement response in the HIV response and how we can approach that and take lessons for hepatitis advocacy.
Thank you so much for the really kind invitation, and what a pleasure it is to have the opportunity to speak about a topic that is as important as it is timely. Youth-driven models of HIV care. What makes them tick, and what lessons can the hepatitis movement gain for the HIV response? Before delving into my presentation, it is imperative to start from the very start. What is the rationale? Providing a rationale and an approach for youth-driven models of care within the HIV response. The strongest rationale, ladies and gentlemen, for engaging youth is not about it being nice, even though it is nice. It's not about it being fashionable, even though lately it's become quite fashionable to speak about engaging youth. The most important rationale is actually steeped in science and human rights. There is now quite a good growing body of evidence that shows that youth engagement actually leads to improved health and well-being outcomes for young people. But beyond those outcomes is also the human rights angle to it. It is actually a right that is protected under the 1989 United Nations Convention on the Rights of the Child. Connecting youth engagement to quality care is really key. In 2016, as some of you know, WHO made one of its most groundbreaking recommendations, really a first of its kind at the time, on providing what was then called adolescent-friendly health services. A further deep dive of what is exactly, or what is meant exactly by adolescent health services was produced in the global standards, which you can see to the right of my screen. Standard 8 actually speaks to youth engagement and adolescent participation. I invite you, all of you, to please have a look, take a further look at these global standards, as they are really key to a deeper understanding of what it means to engage youth, the processes that those involve, and how to monitor, really important, how to monitor successful engagement. On this slide, I speak to some of the concrete examples, practical examples from the HIV response of youth peer-driven models of care, which have proven to be so successful. One of them, the very renowned Jandiri model, published a randomized controlled trial, which showed a direct link between the model of care and viral suppression. I invite you again to take a look at a WHO published technical brief in 2019, outlining 5 of the most successful models with really good outcome data. Jandiri from Zimbabwe, which I just mentioned, Operation 000 from Kenya, Aerial Clubs, Baylor's Teen Clubs, and the REACH model with PATA. Within that brief, you would also be able to see some key peer-based implementation evidence, details of examples and key characteristics of those service delivery models. And this slide goes to, really the crux of my presentation. What makes these peer-driven models tick? And what lessons can the hepatitis movement gain from these models? I have picked out 5 of what I consider the most salient. I've acronymized those 5 as the 5 Fs for ease of reference, really. The first is facts. Facts are facts. These models have done incredible work, slowly but surely working, writing, gathering evidence, and sticking really to the facts of what works and what doesn't work, discarding, of course, those that don't work. The second is fusion, which speaks to the integration of multiple layered intervention relevant to young people. So it isn't just about HIV, and it shouldn't just be about hepatitis. It is other packages of care that should complement the hepatitis and the HIV services. So sexual reproductive health, for instance, STIs, mental health. These are just mentioning but a few. With the integration of multiple layered interventions comes, of course, the need to coordinate sometimes different programs, and that is the third F, on the seamless flow between programs. The fourth F is how they've managed to facilitate continued learning, sharing, and improvements along the way. And finally, of course, fostering youth engagement and having young people right at the core and at the center of these models. My final slide is all about implementation. The main catch points to be aware of as you plan to implement a hepatitis youth-driven models. These are things that shouldn't be an afterthought. You need to think about these from the start. Again, for ease of reference, I've acronymized as the 5 S's. And the first is about scale. You need to think about scale and really to ensure that the models and the approach is not vertical, small cocoons without reach or influence to make any impact. The second is about substance. Substance. Sometimes they say the proof of the pudding is in the eating. That's what they say. But it's very easy, to get lost in the slogans and the tokenistic sort of approach, the bandwagon way. It's really important to focus on the substance and what really works and what is important. Really important as well, to have that universal approach that leaves no one behind. Usually we focus on the general population, but within those are those often forgotten, left behind populations. And we know them, the young key populations, pregnant adolescents, young mothers, and of course, adolescent boys. We need to be able to ensure that as we look at a universal, broad-based approach, we need to make sure that we're not leaving those subpopulations behind. I spoke about synergy in my last slide, so I'm not going to repeat that. And then the final S is on sustainability, ensuring that your approach to youth engagement in the hepatitis response stands the test of time. It shouldn't be vertical, but rather leverages existing national structures and health systems. So I'm going to stop there and just say a special thank you to all the amazing young people who, I keep working with every day. They don't, they never cease to amaze me, how brilliant they do their work. I'd like to especially thank the WHO Tele-Echo webinar series, the organizers of those, who continue to push boundaries and on sharing lessons and helping to cascade best practices and promising practices. Finally, thanks, of course, to the organizers of the World Hepatitis Summit. Indeed, youth can't wait. They cannot wait, including to contributing to the theme, the overall theme of the summit, achieving the elimination of viral hepatitis within evolving health systems. Thank you very much.
And thank you, Dr. Wool Aimion. And do we have one more presentation? Or?
Yes. Right, so we have the last one. Next, we have Professor Amal Saeed from Ain Shams University with us, and she's an active member of the Egyptian National Committee for the Control of Viral Hepatitis. And since 2006, has been charged with the program for prevention and management of viral hepatitis. Professor is going to answer the question of the day: how can providers and others support a youth movement?
Thank you very much, and thanks for the organizers, of course, for inviting me and for the World Hepatitis Alliance. And I'm going to be very brief. I know we're running out of time, but I'm going to show some examples of how the providers can be at the center of this public health problem. I think they can play a very crucial role. The providers can lead to public engagement and empowerment of the public, patient support and talk to patient support groups, talk to the media and politicians, physicians, researchers, health associations, and also help with government advocacy and policy change. I've started my work with children infected with hepatitis in 1990. It's been more than 30 years now of my practice and work, and I've always advocated for the rights of children to access both care and treatment and diagnosis. And I think this is one key crucial role that the providers should play in their communities. So advocacy is really important. Advocacy and talking to other physicians, talking to the civil society and working with the civil society, and also talking to key opinion leaders. And I think all of this helped in moving our program forwards and establishing a real national committee for viral hepatitis in 2006. And we were actually the first country to do so. Awareness can be at the level of the patients and families at all times. I sit with my patients for a very long time to explain, not only to the parents, but also to the children. And even the smallest children understand when you talk to them and you try to make a connection with them. It's really important that the provider bonds to their patients and be their safe haven. Care providers, awareness among your colleagues, among the nurses, among other employees in your hospital, among students, especially medical students, and I'm going to show some examples, for the public and through the media as well. Removal of stigma and discrimination, both at a public level and at the patient's level. We listened to the amazing talk by David, and he mentioned that he's self-stigmatized. It's very important that we talk to our young people, to the children, and tell them it is okay, you are fine, there is cure, you're going to be okay. And sometimes when I explain to them, rather than telling them that you're infectious, I tell them, please take care of your wounds. If you're injured in school and you clean it yourself, we don't want anybody to infect you with germs. So it's just the way the message reaches your children and your patients. So I'm going to show some examples of our university campaigns, and these were really helpful. And I think if the youth movement is going to start, I think it should start at this level. University students are amazing. They are really fantastic. They're innovative. They have great ideas. We had the goals of improving knowledge and attitude of youth about viral hepatitis and improving viral hepatitis prevention behavior among the young people, increasing protection from HPV by vaccination and follow-up boosters, and improving HCV testing. And our key audience at that time were the youth, the healthcare providers, the faculty members, and the employees, even the non-medical employees. And the rationale was it was a critical entry point for health messages. And more than 50% of the Egyptian population were below 20 years. And now almost 60% are below the age of 25. So it's a very young population. And I think the whole of Africa, more than 60% are below the age of 25. And the health care providers are most at-risk groups, and medical students, of course, and those working in nursing and pharmacy schools. So those are some of the program highlights. We had at the center, one of our young actors at that time who was really well-known and loved by the young people. We had also a famous actress, and we had booths in every single university. We reached out to 9 universities all over Egypt. and 100,000 students. By the end of the campaign, we had also 6,000 volunteers. We trained students to be trainers. They were the ones who were educators, educating their peers. They were the ones standing at the booths and desks distributing material. And we had those from the World Health Forum, young people, 110 volunteers in the beginning, and we ended up with 6,000 volunteers. More than 100,000 students were reached, 30,000 students were vaccinated against hepatitis B, and the rest of the 100,000 had discounted coupons for vaccination. And then we had all universities advocating for obligatory vaccination against hepatitis B in medical schools. And we had also multiple private-public partnerships. We had information booths on campus, sports events, seminars in the faculties, face-to-face awareness, and we had arts and knowledge competitions, fantastic media coverage, and of course, the vaccination. And then we had another campaign on hepatitis C. So a test and eradicate or test and cure hepatitis C. And the outcome was awareness, education, and empowerment of the young people, screening among the students with a prevalence rate of 0.5%. Most of those tested, all of those tested received treatment. And we even tested the employees as well. And that was before our national screening campaign of the 100 million lives campaign, screening 50 million of our population and 12 million so far of school children. Among the employees, we had almost 7% positivity and we treated them all. And it's important to know that those campaigns, because of the huge awareness and the activities in different universities, that in itself removed the stigma from hepatitis. Another example was our project, the Hepatitis C-Free project. That's an NGO project. I'm the Secretary General of the Egyptian Liver Care Society. We've been treating children from hepatitis C since 2008, before the government adopted treatment on a nationwide basis. I've been treating children from donations since 1993, and not a single child under my care since then did not receive treatment, neither for Hep B or hepatitis C, or received as proper diagnosis and follow-up. We had awareness and interactive sessions with parents and children, explaining to them how the virus is transmitted, how to protect themselves, how to protect other people, and what to do and how to do this and that. And also during the COVID, we also explained to them how to protect themselves from COVID, and we had sanitizers everywhere. We also had a website, so they shouldn't come, they didn't have to come on a regular basis, so they can check on the website and be consulted on the website. And then we distributed also prevention and personal materials and personal care items on a monthly basis, so they understand that they should change their personal care items and they should not share with others. And in fact, this campaign was really fantastic, and it removed a lot of stigma relating to hepatitis. Also the media, we were all over the media for many years, both the visual media and the written media. We were newspapers, we had at least tens of monthly articles in magazines and the news. I would like to see the youth movement here. We had only one article in the Newsweek about hepatitis C, but many were in the Newsweek and Time on the HIV and AIDS and and other diseases, but not on hepatitis. I think we need to have a youth movement coming to the media very strongly, international media, and on the front page of international magazines. Of course, we have the social media, and we've learned how powerful social media is for the young people. Egypt also, physicians made the headlines in the New York Times and the Atlantic, and that put Egypt at the forefront of the hepatitis C elimination. And I think it's very important that the young people should be at the forefront of those campaigns. So it's a continuous delivery system for sustainability. We need to be engaged as providers with continuous stakeholders engagement and advocacy for awareness and testing and treatment, as well as follow-up. Thank you very much. And I think I would agree, I can't agree more than children and youth can't wait. And I would like to add children as well. Thank you very much.
Thank you, Professor Manel. And I'm going to go in and ask one question, even though we're over time. And I think this question really reflects to David's presentation. But how can adolescents with hepatitis overcome the shame and fear to be bothered with the receiving hepatitis care?
Thank you for relaying that question, Matthew. It's definitely a multi-pronged approach that needs to be taken. This includes having sort of role models and people that have experience in living with this, be at the forefront for when diagnoses happen. I think a lot of people could fall through the cracks, so to speak, with messaging as well. I remember standard US sexual education class. We spent about maybe 5 or 10 minutes on hepatitis, and it was all warnings and all you don't want to statements. And I remember just shrinking back in my seat during that presentation and just kind of trying to be as invisible as I could. And I remember that, you know, there's certain types of education that can be effective for different age groups. And I think that anything fear-based is just not going to work for adolescents. And I think there just needs to be a better system of supports in place already for so that these kids don't fall through the cracks and feel as alone as I did.
Thanks, David. And Tasnia is going to give us some closing remarks.
Right. Thank you everyone for joining us today. I think it was a really important session to have, and I'm really honored to have the privilege of chairing this. And I know we heard about the benefits of the youth who are like David, who are suffering from hepatitis, to talk about it and be involved in advocacy. But I also like to take this opportunity to talk about the benefits of youth engagement, in particular medical students, since I have been that. So I always said this to every BMSS member as a reminder that as medical students, we aspire to become doctors and contribute to health. But that takes us 6 years, counting from the day we enroll in our university. 6 years is a long time. So if our goals are set, why do we have to wait for 6 years? If we can simply realize that health is multidimensional and that preventing a health condition is just as contribution to health as treating it, the world would be different today. At least that's what I think. So if we can get medical students to do a lot of things, we can get them to do surveys in their hospitals, patients who get newly diagnosed with Hep B before scheduled surgery. We can collect data on how many seek further help to like a hepatologist. We can use the youth workforce to create an entire referral system. We can encourage them to create youth support groups that make it easier for young, newly diagnosed patients to speak up about their disease. Really, I believe the opportunities of the youth are endless. And I hope after this session, we all really start thinking about it. Thank you.